So this is the chiropractic personal injury webinar. Specifically, what we're going to cover is the documentation and the marketing that essentially makes it work. And more importantly, why and what are the doctors doing that why it doesn't work. So we're going to go into great detail and we're going to cover some main subjects and some of the things that we're going to be answering. Here's some of the major topics we're going to be answering. Number one is we're going to be answering what the potential is. There's way more potential than what doctors realize, but there's also significant what are called psychographic barriers that doctors don't realize and they're not overcoming. And that creates a problem to accessing personal injury. So we'll talk about the market potential. We'll talk about what it takes to get your bills paid. So I never had an attorney ask me to reduce my bill. And I never had none of my bills not paid. And I'm going to share with you exactly why. If you are, I'm going to show you exactly why. We're also going to go into why the attorney asks you to cut your bill and how you can stop that from happening. And obviously we'll go into how to stop IMEs. We'll go into also asking the attorney to ask you for a referral. You know how sometimes they'll say, well, you refer me one, I'll refer you one. Never happened. Never had an attorney ask me for a referral, never had an attorney cut my bill. And you'll see why by the time we finish. And I created a lot of business, created way more business than what I could physically handle. I had to hire multiple associate doctors, things of that nature. So again, I'm Dr. Paul. I've opened 77 offices in 20 states. I'm past speaker in 3 chiropractic colleges. I've authored 10 books now, so I teach personal injury, continuing education to chiropractors and attorneys across the nation. And how it all started with me is when I was in practice, I started doing some personal injury. You know, to be honest with you, everybody knows it can be more lucrative, but I was also just kind of bored with the general practice, and it was more challenging. Doing personal injury is like a chess match to win the case. So that's another reason I did it. It was way more exciting than being in practice, to be honest with you. And so the short story is, when I went and gave a attorney presentation, and you'll see the components that essentially creates referrals, and I'll share with you the common mistakes of why you're not getting referrals and why attorneys don't refer to you. So anyway, I did a presentation to this attorney, and it was a patient. The 30-second version is, this lady was in an accident to no fault of her own. She had some back pain. She didn't have any disc problems, no nerve problems, nothing like that. She did go to the emergency room, and then several weeks, a month or two later, she went to her general practitioner. And as you know, they do the same thing. They tell her, we can't find anything. You have, muscle spasms. Take these pills. So they give her pain pills, muscle spasms. So you know the story. If you're a chiropractor, been in practice at any time at all, you know the story. That's what happens. So after I did my presentation with the attorney, he had no idea what chiropractors did. He didn't know how we could help or not. He'd never used them before. So I explained what we do and how we do it and how it benefits him, etc. So he sent the case over. And this particular case, the insurance company was offering nothing, zero. So we worked her up, brought it back, and then I showed him all the documentation that was missing. Wasn't even done by the emergency room or the GP. And that's why they were saying that she was essentially normal, because they didn't even do the documentation that found the problem. So we put it all together, and then I explained it to him. I said, this is how it all connects. I went over all the categories of documentation. I explained why she had a permanent problem. I explained all the different categories that she did have and how it was going to be a permanent problem to some degree the rest of her life, and I gave her an impairment rating. In other words, I put it all together for him, and he'd never heard anybody talk like this. He was just getting medical records, and that's it. He didn't know what to do with the case. So we went to court, and so I spent a couple days in court. So it was my testimony against 2 medical doctors, both of them saying there was nothing wrong. Short of the story is, I did all the documentation that they missed. I put it all together, and the jury comes back with a policy limit award. That particular policy was $110,000. So it went from 0 to $110,000. And this was just a soft tissue injury. She did not have a disc injury. She did not have a nerve injury. She did not have a mild concussion. She did not have a fracture. And so bottom line is everything that I said, everything I told him, how it all comes together, came together. And of course, he went from zero to $110,000. He gets a third of that, so he just made $35,000, $37,000, all because I stepped into his office to show him how it all comes together. In other words, I created his $37,000 check. That's how it works. And of course, that was it. He sentenced me everybody, and then everybody, his friends find out, and they send me everybody. And I was in a small town. I was in a bedroom community. I was in a kind of a rural area outside of a major metropolitan area. And my community was 3,000. We had two chiropractors and a population of 3,000. If we went out maybe 3 miles, 5 miles, it might get up to 3, 4, 5,000. But that's it. So we didn't do a lot. There wasn't a ton of personal injury, but whatever personal injury he got, when those patients lived in my part of the county, I got them all. And then, of course, I had a personal injury office separately at another location, and then I had, multiple offices, etc. And this was one of the components of how I opened 77 offices in 20 states. It wasn't the only one. They were not all personal injury offices. We were real big into accepting cash, Medicare, major medical, workers' comp. We accept everything. So it's not just personal, but we have doctors that do just want to be personal injury, so that's fine. So that's what happened. So some of the results. So we started teaching it, and we have tremendous results. The system works really well, and we had tremendous results. I remember I went to one of my clients in California. Dr. Seamus is in California, and we put together an attorney presentation. And so I actually did a live attorney presentation for him, and he actually did a fantastic job getting the attorneys together. So he had 52 attorneys in that room. I go through the sales presentation. I show them how it all works, how it all comes together. And you'll see that when we come through here. I'm going to show you exactly how it all comes together. I'll show you exactly the problems and why you're not getting referrals and how you do get referrals. And we had 98% of those 52 attorneys sign up to refer their soft tissue injury cases that were in his geographic area to him. And then there was another area where there was a lot of the attorneys had clients. We opened a second office right there. And within 6 months, he was seeing his satellite office was seeing 200 visits a week. So now he has his main office. He sees about 500 to 700 visits a week with 2 associate doctors. He does over 50% personal injury. He's got a second satellite office that has seeing over 200 visits a week, and he just hired an associate doctor for his associate doctor in the satellite. And now he's getting ready to open his third office. That was Dr. Sheridan. So we increased his business about $3 million. Dr. Joe Hernandez, he's in Southern California, did the same with him. He was seeing about 120 visits a week, took him up to over 200. His first associate doctor maxed him out. He just opened his second personal injury office. Matter of fact, he was just in a major case where it was a disc. It was actually surgery with a disc, and his attorney used him as the only live witness in trial because he was the only one that knew how to put it all together. He did not use the orthopedic surgeon, and he did not use the pain management doctor because they didn't know how to put it all together. They just knew their little piece of the pie. That's it. He took that case. He was the only doctor giving testimony, and he used our training to put it all together. He took it. They offered him $45,000. They got a jury verdict for $2 million. Dr. Updahl in state of Washington, he started with me with one office and no associate doctor, seeing 120 visits a week. That was about 3-4 years ago. Now he has 5 offices, 7 associate doctors. Dr. Brian, he's also out there in Washington. He started with me with, he was doing pretty good. He was doing about $500,000 to $700,000 a year when he started. And he had 1 associate doctor. So we took his business up $1 million, opened the second office, just like what we do. That office collected $1 million its first year. Its first year was this last February. Collected over $1 million its first year. He just opened his third office. Dr. Packer in Virginia, he jumped on with me, learned how to do all this, increased his business $1 million a year. Go ahead and